So no, you can't only spread it if you have an outbreak. Herpes can be transmitted different times throughout an individual's basically life. It can always be transmitted. However, it's most likely to be transmitted, or it's most transmittable right before an outbreak. So when like an individual feels like they have this tingling sensation or something going on, that's when they're at the highest risk of transmitting it. And also right where they have like the actual outbreak, and you can see the kind of like sores on the genitals or on the oral region, and then they can spread the virus that way.
That's how I got it. I'm serious. I got it from my dad.
Are you a liar?
No.
Yeah, no.
I think that's not true. I don't think that's true.
I would say false. I'd be damned if that's true.
Other ways besides sex to contract an STI. One of the common ones, herpes. There's two different types, right? So there's simplex 1 and simplex 2. And oral herpes is actually fairly commonly transmitted between mother and child. So when an individual is like born, herpes is so common amongst the population that if the mother has it and just kisses like the child on the cheek, the child can get it transmitted that way. But it's also an STI.
1 in 4 adults in the US have herpes. But it doesn't actually mean that 1 in 4 adults are sexually active, sexually promiscuous, and have had unprotected sex. Nothing like that. Because somebody could contract herpes when they're really young. If you think about it, Aunt Sally might have herpes on her mouth, go see her new nephew, kiss him on the mouth, leave, and then that nephew contracts the virus, and then when he's 12 years old, he gets an outbreak. Never been sexually active. That happened in infancy when they were born.
Well, I think it's obvious that it's through some sort of sexual activity or a close touching.
Not wearing protection and being a dumbass.
So I guess they're transferred mostly through the fluids in your genitalia region. And condoms can prevent the transmission, but not in all cases, and I guess they reduce the chance of transmission, but still have a chance that you could get it. Can't be too safe, I guess.
Sex, oral sex,
Sodomy.
sex, vaginal, penile intercourse.
Holding hands.
Genital. Genital.
Oral, anal, and vaginal sex.
Not washing wounds and just not being sanitary in general.
Sexually transmitted infections can be transmitted either skin to skin or by fluid. The fluid STIs are chlamydia and gonorrhea. Syphilis can also be a fluid transmitted STI. Skin to skin STIs are herpes, also known as HSV, genital warts, which is also known as HPV, and syphilis is also a skin to skin depending on what stage it is. There are some other ones, but those are probably the most common. HIV is also a fluid transmitted STI.
99%.
Yeah, I think it's pretty effective.
I think it depends on the type. I mean, there are some things like HIV, for example, is contracted through the bodily fluids, and so as long as you're protected from those, you should be fine. But something like genital herpes, if it's in the area around the condom, I think that you could get it pretty easily.
Well, it's like 80% or something like that.
But I wouldn't use that as like 100% fail-proof method for transmitting disease.
The birth, or I don't know. The chance of birth is like 99.9 or something, so I'd guess that's about the same for sexually transmitted infections.
90?
Yeah, I mean, it's probably up there.
90%.
Do you say that they condoms prevent against most STIs. They can contain fluids, they contain the semen and also provide a barrier for vaginal fluids, also provide a barrier for blood, and lubricated condoms or condoms used with lubrication can often reduce that risk of those micro tears. For skin to skin, condoms cover some skin, but if you think about it, male condoms only cover certain amounts of skin, as with female condoms as well. So there's still some skin involved just by the nature of sexual activity. So that's why we say only most STIs, not all. It's not foolproof.